So I have curated some more important topics, guys. These topics are very highly important because I have seen in the January 2024 examination almost 30 topics were came. 2024 June 50 topics. This is the one I have cleared my examination, and the 2025 January 50 questions plus June again 50 plus question, last Jan 50 questions. Okay, this has been continuously has been seen. Okay, should not be missing. I have created almost 100 topics. Okay, neonatal resuscitation, basic life support, airway management from the anesthesia, trauma, complete trauma, and in the trauma you have to mostly head, stomach, I mean abdomen, and also lung fields. Important. Nutrition, highly important. Vitamin deficiencies, amino acid disorders, genetic disorders, dermatomes has been asked, nerves and their injury, malaria drugs and malaria protocols, IMNC for the pneumonia and the diarrhea, audiology and tympanometry, MTP, hepatitis serology, chest trauma, STD kits, STD diseases, psoriasis plus treatment and psoriasis plus types, milestones, all the fine, gross language, all the social milestones, lysosome storage disorder, glycogen storage disorder, mucopolysaccharides, cataracts and types, right? Radiosensitive versus the radio resistant table, epilepsy and their drug of the choices, gout and drug of the choices, diabetic drugs, okay, all the oral hypoglycemic drugs, TB, HIV, anti-glaucoma drugs and their side effects, ECGs and treatment protocol, vaccines, bone tumors, schizophrenia and drugs, depression and drugs, toxicology, antidotes, substance abuse like withdrawal or intoxication, food adulteration in the PSM, demography and their formulas, neural tube defects, pharyngeal arches and derivatives, and leprosy, organic mental disorders such as dementia has been asked, and the patient who are suffering from the dementia, delirium, Alzheimer's, Parkinson's. Okay, Alzheimer's and the Parkinson's. Thyroid. In the thyroid, it can be hypo or it can be hyper, and even cancers. Breast cancer and staging, or drugs also you can take note. Urethral trauma, parathyroid, lymphomas, leukemias, especially in the lymphomas, leukemias, you can add multiple sclerosis and also translocations. Okay, sorry, multiple sclerosis, I'm sorry, this is not the multiple sclerosis, guys, this is multiple myeloma. Okay, multiple myeloma, that topic is very important. Hematology, in this peripheral blood smears, that is important. Jenkers, achalasia, ulcers, GERD, peptic ulcers, that is important. Lung tumors and histopathology findings, pneumoconiosis, glomerulonephritis and microscopy findings, amyloidosis and their types, squint, extraocular muscle and cranial nerves included, and their paralysis, vitamin A deficiency, anemia and anemia Mukt Bharat scheme, and anemia types, right? All these are important. Larynx anatomy, right? Cartilages and muscles, these are very important in the larynx. And nerve supply, nerve injury, nose bleeding, CSF rhinorrhea, paranasal exeresis, different types, palsy, facial palsy, rickettsial diseases, biosafety, okay, the waste management in the hospital, disinfection and the filtration of the water, types of oncogenes, tumor markers, sexual perversions is nothing but the paraphilias. Along with that, you also have to take note about the semen test and also blood test. Identification, again, the skull, pelvis, and also fingerprints and dental. Head trauma, especially EDH versus the SGH. Myocardial infarction, the markers and ECG and findings, right? diuretics and the mechanism of action, collagen and the diseases, LFTs, bone metabolic disorders like osteoarthritis. Next, TB spine and their findings, JVP, hypothalamus areas, sleep cycle and patterns, O2HP dissociation curve, congenital defects. It can be heart related or it can be respiratory related. Vertebral levels, palpable pulses, image based question, anatomical triangles like cubital fossa, anatomical fossa, and popliteal fossa, femoral triangle, Hasselbeck's triangle, and also Calot's triangle. These are number of triangles that will be present in the posterior anterior neck triangles also. Hernia and the therapy, varicose veins and the classifications, and valvular heart diseases, infective endocarditis, the Duke's criteria, contraception, especially the emergency contraception, acid-base disorders, and glut types of the gluts and their openings, JIT hormones, mycology, and chemo drugs and the side effects, very important. Parkinson's mechanism and the drugs, migraine and therapy, asphyxia and types, epidemiology studies, and their formulas, calculation formulas are very important. Ear nerve supply, laryngeal disorders. And some other things that you have to remember is the intubation, hypersensitivity reactions, pemphigus, Alzheimer's, Parkinson's, and also postpartum hemorrhage. And also take note about the placenta types, different types of the placenta types that you have to take note. And consistency is more important than the perfection. Again and again, I am emphasizing that consistency is very important. These are the some of the and most important topics. Even if you cover these important topics from your revision notes, you can easily clear the 150 plus. Okay, definitely, I'm going to assure you guys. So please do subscribe and share with your friends, and please do join the Telegram group and also subscribe to our channel. Like and share with your friends also. So happy preparation, guys. See you again in the next video.